introduce ourselves. Start with Commissioner Flowers.
Renee Flowers, Pinellas County Commissioner, District 7. Good morning.
And Commissioner Fig Sanders, over to you.
Good morning, Deborah Fig Sanders, St. Petersburg City Council, District 5.
And good morning, I'm Vince Cox, Pinellas County.
Good morning, I'm Brad Miller, CEO of PSDA.
And it is nice to see all these faces. We don't have the masks as much as we've had in the past, so good to literally see everyone. First item up is public comment. Do we have any public comment for today's meeting?
There are no public comments.
Thank you. Seeing no public comments, we'll move on to action items. The first action item is an approval of the March 23rd, 2022 minutes.
Move approval of the minutes.
We have a motion.
I'll second that motion.
Thank you. We have a motion and a second. All in favor, say aye.
Aye.
That passes unanimously. And so we're moving on to our second action item, which is the TD Equity Fair Policy Recommendations. Brad, are you introducing this at all, or are we going right to Nicole and Cassandra?
Oh, I think,
Excuse me.
Okay.
Nicole got it.
Needing no introduction, as they say.
I think we're just going to try to share this presentation with you first while pulling it up. Morning, board members. I'm Cassandra Borchers, Chief Development Officer, and here with me today is our project planner, Nicole Dufa. And you may know Nicole from her work on our strategic sustainability plan. However, she's also working on some equity initiatives that we have. Last May, we brought you some work that we were doing with regard to our fair policy, and today she's going to show you some of the research, the investigation that she's done, and make some recommendations for how we can move forward with an equitable conversation about fairs. I'll turn it over to Nicole. Thank you.
Thank you, Cassandra. Good morning, Mr. Chair and Planning Committee board members. My name is Nicole Dufa, and I'm project planner, and I'm here today to present to you our latest step in our recommendations for fair equity. The action item today is to approve a recommendation to the Fort Pinellas Local Coordinating Board to increase the eligibility threshold for the Transportation Disadvantage Program from 150% to 200% of the federal poverty level. And so you may remember, as Cassandra just noted, that we came to you last May and we were studying the national trends on equity in transit, as well as more specifically looking at how we can increase equity in PSTA's fare structure. We first recommended the launch of flamingo fares as a way to improve equity with the daily and monthly fare capping, and so that launched last year. Our second recommendation to you is well underway and was to improve access to the current low-income reduced fare program, and our mobility team is very much working on that. And our final recommendation was to expand our low-income reduced fare programs. And so that is the recommendation before you today and why I am here. So about PSTA's Transportation Disadvantage Program. It is a discounted fare program for riders earning 150% of the federal poverty level or less. In 2022, 150% of the federal poverty level amounts to only $9.80 an hour when working full-time. And those who qualify with that income pay only $11 a month for their bus pass versus the full cost of a monthly bus pass, which is $70. So that means our Transportation Disadvantage, or TD for short, our TD riders are saving $59 a month on transportation costs. That's a huge deal when you're living on a very tight budget. TD riders are required to recertify their income annually. And so when we restarted fare collection last summer, we, after being free for over a year, we quickly recertified our TD riders as early as June 2021 before we reinstated fares so that they would only have to pay the $11 a month once they had to pay again. This income recertification would have happened before Florida recently increased the state minimum wage to $10 an hour. So this means based on the current 150% of the federal poverty level at $9.80 an hour, when current TD riders, so anyone enrolled in the program now, has to recertify again this year, assuming their wages have increased to $10 an hour, they will no longer qualify for the program. And that means that they are no longer eligible for the $11 a month bus pass. So let's think about the impact of losing that benefit. Most people know that we shouldn't spend more than 30% of our income on housing. After housing, transportation is the second highest expense for many households. So for the top two biggest expenses in any household's budget, housing and transportation, for that to be considered affordable, we shouldn't be paying more than 45% of our income on both of those costs. In Pinellas County, per the Center for Neighborhood Technology, the average household actually spends 57% on both housing and transportation costs. That's over 10% more than what is considered affordable, leaving less than half of that income left over for basic expenses like groceries, healthcare, and other items. And that the United Way has a survival budget that they calculate as an amount that you should earn in order to afford basic needs such as housing, transportation, healthcare, and et cetera. And that survival budget, just to survive, is $13.75 an hour. So by considering a move to 200% of the federal poverty level for our TD program, which for the single person household at 200% of federal poverty level in 2022 is only $13 an hour, we would be offering significant savings in the transportation portion of their budgets, allowing that household to spend more money on other important expenses, which we know are getting more expensive. All of our expenses are getting more and more, rising the cost every day. And we know that Tampa Bay is one of the hottest places to move to, and the rising cost of living here is reflecting that. Housing values and rental prices are skyrocketing. We've seen in Tampa Bay alone a 24% increase in the cost of rent. And when you look at our 2020 census numbers, we have about 11% of Pinellas County living below the poverty level. But when you look at 200% of the federal poverty level, those folks earning $13 an hour, that actually increases to 30% or more of Pinellas County residents earning that rate and essentially earning a survival budget's worth. So those people are who we're thinking about when we are looking to raise the TD threshold from 150 to 200 and helping them with reduced transportation costs. So we also wanted to reach out to our riders to ask them about some of their financial questions, how they felt about flamingo fares, as well as their income and ridership habits. We did this survey in December of last year, and the survey respondents leaned heavily towards the lower incomes, where over 60% of them said that they earned 150% of the federal poverty level or less. We asked that through a series of questions about income. And they're also more likely to be enrolled in social service programs like SNAP benefits or using Section 8 vouchers for housing. And they also think that they should qualify for an income-based discount based on their income. And so these are the folks that we're thinking about who could become ineligible for TD when they recertify again this year. And so on the financial side of this conversation, our Transportation Disadvantage Program is grant funded. And in 2019, we received $3.6 million from the Commission for the Transportation Disadvantage for this program. And this money is used to reimburse PSTA for the cost of monthly bus passes that we're selling at $11 a month. And in 2019, PSTA averaged 5,600 bus passes sold per month. And it was actually so popular that we exceeded the grant funds and we were unable to bill for reimbursement for all of the passes that we sold because people relied on this program. In 2022, in 20 and 21, we had some differences in grant funding because of the free fares. But in 2022, we were awarded a formula allocation of $3.6 million again. But we're seeing something different with our decreased ridership. We're actually selling more than, we've reduced the sale of our TD bus passes by more than half per month. So we saw that as recently as December of 21. And so because of the reduced number of bus passes that we're selling through the TD program, PSDA has not been able to draw down its full allocation of the grant. And we're actually approximating about 25% under budget. And so if that trend continues to the end of the year, we'll likely be about almost $1 million left of our grant, about $900,000 left if we're not able to draw down all of those funds. And this is on top of the award that we will receive for 2023, which we were just notified about, where they're increasing our formula allocation by $500,000 to $4.1 million. And so if we implemented the increase to 200% of federal poverty level, PSDA would likely be cost neutral, using that extra funding available to us in order to bring more folks into the TD program. So we see this as really good for Pinellas County, great for its residents, and it wouldn't hurt PSTA. And that is why we are presenting this action item before you. We ask that you approve a recommendation to increase the TD eligibility threshold from 150% to 200% of the federal poverty level, which will go on to the local coordinating board for final approval. We think this is an important change that we should make when considering equity, the challenges our riders face when it comes to the rising cost of living, and how we can make a positive impact in our community. And we also hope this change brings more people back to PSTA, more people riding the system again, addressing some of those concerns we saw when looking at our ridership numbers during the Finance Committee. And with that, I'll take any questions. Thank you all.
Thank you, Nicole. Thank you, Cassandra. Are there any questions? Commissioner Flowers, can you hit your button there? Oh, no,
This is
you're good.
already black there.
It is now.
Good morning, wonderful presentation, and I certainly, you didn't have to try to sell me on this. You know, it's already sold. The question I have, though, is because we could potentially have thank you, because we could potentially have 900,000 left on the table, you did say that we would receive, based on allocation, 500,000 additional dollars. Do they come back and reduce your amount because they see what you didn't spend? Typically, that's what folks do.
Well, so I know that we want to prevent that from happening, and so this expansion to 200% of federal poverty
We'll
level,
use up that
we'll hope to use up that $900,000 so that we don't leave anything on the table.
Because I was just gonna make a suggestion to get rid of the money if we didn't have one.
Yeah, so with that 200% increase, we're hoping that it draws down that money so that there's nothing left on the table.
Okay, and I'm sure you're already thinking about it, but huge marketing plan around, you know,
Absolutely.
what we're doing here to expand that so that persons will know they qualify.
Absolutely. We historically hadn't marketed the TD program because it was so popular and we couldn't afford to reimburse all of the bus passes, but we do plan to do an extensive marketing promotion with the new eligibility so that folks know that they qualify. Absolutely. Thank you, Commissioner.
Thank you.
Thanks.
Commissioner Albritton?
Yeah, just a comment. I'm glad that we're gonna be doing this. I think it's a great, idea about using up the funds so we don't get shorted next time. So, if it doesn't hurt PSTA and it's an advantage for the community, it's a no-brainer to me.
Thank you, Commissioner.
And you are on Ford Pinellas, are you not?
Yep.
Yeah. So I think this will ultimately come to the Ford Pinellas Board for approval.
As the County Planning Authority.
The recommendation goes to the local coordinating board, which then forwards it to Forward Pinellas, where is final approval.
At the full speed of government.
So that's all we,
The state requires that.
Yes.
so what we need is those two approvals then, right? The LCB and then Forward Pinellas. All right, that's it, that's all I have, thanks.
Commissioner Fix-Sanders?
Thank you, good morning, and thank you for the presentation. And great minds think alike, because I was also thinking about the marketing piece. But my recommendation, after hearing your response, if you didn't want to do a wide marketing, then of course we can benefit the target audience that we already have concerning the affordable housing programs and those receiving Section 8 to start from there. But I was curious, what is the actual number of the number of survey respondents? It gives a percentage, but it doesn't really say how many surveys were completed.
Yes, so the survey was administered online. We promote it via text message. So we have a bunch of writers. So the survey respondents that I was looking at there was about 350. for that online survey of valid responses of folks who lived in the Pinellas County and Tampa Bay region. We do have a lot of visitors to our region, and they sign up for the text message service, so we got a bunch of responses from people who visited. So the larger number was bigger than that, but 350 were from Tampa Bay specifically.
Okay, all right. Thank you so much. Thank you, Chair.
Thank you both for the presentation. I know we have long had conversations here as well as throughout the county on affordable housing. And while there's a ton of work being done to create more affordable housing, this is something that we can do to ease the pressure on the overall financial pie that everyone has to deal with, and it's immediate, or semi-immediate, because it has to go through 2 other committees. So I appreciate the fact that we're being fiscally responsible from an organization side, not wanting to leave available funds on the table, but more importantly, PSTA as an agency doing its part to relieve the overall financial burden on the pocketbook, especially since the housing portion of that is taking up an ever increasing chunk. Just for my own information, you talked about the survival budget. Is that for this area, or is that like a national average, or?
The United Way produces a report for several states, and it's the state of Florida.
Okay, so not going to change my mind one way or the other. I was just interested on that piece of information there. So are there any additional questions? Nope. All right, I will entertain a motion.
Approval.
Second.
Motion, and everyone seconds.
Yep, put it just like that.
All right, all in favor?
Aye.
That passes unanimously. Thank you both, and thank you all here. Bonnie, I believe, I don't know, Brad, if you're going to introduce this at all, is up with our PSDA Access Accountability Monitoring.
So, as you all might remember, a month ago, we had a really good discussion at this committee level about our PSA Access program. And thanks a lot to ideas that many of you had on ways in which we might monitor service. This is our first report. Bonnie's going to walk through it.
Yes. Good morning, Planning Committee. So as Brad mentioned, we're just going to quickly go through our PSA Access accountability metrics, a little one-pager that you should have at your place. It's like this. So just quickly going through the graphs that we have here. The first one is our PSA Access ridership. So you can see that the long-term trend that we have for ridership is Access ridership decreasing a little bit, MOD ridership increasing over the years, so that in the past few months we've seen the ridership split about 50% of the rides taken on our MOD, Mobility on Demand service, 50% taken on the Access pre-scheduled service. Next graph here we have is our monthly Access complaints. So we've set a new complaint baseline of 17 monthly complaints per month that we're looking to be under. In March of 2022, we had 8 complaints, so well under our complaint baseline. The next graph here is our on-time performance, something we've been really striving to improve. And, you know, we're really proud of our on-time performance, well over 90-95% when we're looking at both the Access service and Mobility on Demand. Going down the left-hand side of the one-pager, we have our software improvement milestones. So this is, as we were talking about last month, the metrics that we're looking to improve with the spare software. So we've already achieved a few of our milestones, like we mentioned last month. The next milestone is set to release this coming Friday. We're really excited about that. We think we'll see a lot of improvements, especially on the efficiency side. And then the next improvements will occur in the next couple months. The last box on the left is our contract status. So you can see that we've only spent $173,000 to date on the spare contract out of a total contract amount of $1.6 million. Then going down the right side of the chart, at the bottom, we have our 30-minute adherence. So this is looking at specifically standing orders that may roll out at a time a little bit later than what we've requested, as well as flowbacks to our user subcontractor from First Transit. We're definitely improving there. Some of the improvements that we've made last month, collapsing our pickup windows, we've seen a lot better, close to 100% in March, and we're really hoping to see, again, improvement in April and May to come. The last box is our will call fulfillment. So this is looking at trips that are ready early, and then riders that miss their pickup window, a doctor isn't ready or something, they need to call us back and they need a later pickup. So 57% of the time in the month of March, we were able to pick those riders up within 1 hour. We're definitely looking to improve that in the future. So that's our one-pager. We're going to continue to track these metrics every month. And I'm happy to take any questions.
Commissioner Cox.
Hello, thank you, Bonnie. Thank you for this comprehensive report here. I want to go down our improvement milestones here. And I want you help me understand them too, all right? And,
Sure.
okay, the trip flexibility override, I understand. Okay, the live duty global optimization, could you kind of break that down into layman's terms?
Yeah, for sure. So we're really excited about this new feature. So the live duty optimization will in real time have trips moving around. So I think, as you know, we have a lot of issues, same day, clients ready early, cancellations, no-shows. That will move the trips around in real time. So if a driver's running late, it may take some trips off of that driver, move it onto a driver who might have some cancellations. So that feature right now is in testing, and we are on track to release that this Friday.
Okay, so then the next step with that would be the manual trip assignments in the end of May, is that correct?
Yes, so that feature we've talked about is, if a dispatcher sees, I want to move this trip to this specific driver.
Right, and so that's very important. So at least I'm glad to see it's on the horizon. Anyway.
Yes.
I understand dynamic driver breaks, reporting improvements, so on and so. So to me, the most important component is right there to manual trip assignments, that it needs to be given to the provider in real time, because the driver goes to, let's say, Florida Cancer Center downtown St. Pete. The person's still under treatment, and so they have to leave. Well, there's no real known entity when that person's gonna get up. We shoot for an hour, future pickup, but we're at 57%, which is it 50? Yeah.
Yeah.
I'd like to see that improve. I really wish we could keep it an hour or less. If somebody misses the ride for no fault of their own, even if it's a fault of their own, we gotta understand it. We gotta do this right. But to make this all happen, it has to be in the hands of the company that's providing the service. And, good. I mean, these are all good, and I look forward to continued reporting on this too. That's all I have to say. All right, thank you.
Yeah.
Thank you.
We're excited too.
Any additional questions?
Not for me.
I just have a comment.
Commissioner Albritton?
I'm glad to see that this was, the complaints came down. My concern last time we talked about it, it was, it seemed like we were talking about a longer period, and this was a nice fall off from last month, so kudos on that.
And yes, it's good to see the trend going the right way and certainly below baseline. Quick question, can you remind us when we started the program to move people, to educate riders about access versus mobility on demand so that they're using the right?
Yeah,
system?
well, we've had the Mobility on Demand program running really for a long time. 2018, we had a little bit of ridership. It was really throughout 2019 that we added more riders. But actually, by early 2020, we hadn't had that many riders move over. It was really throughout, the pandemic time up until July of 2021 that we saw chunks of riders start to move their trips over. And that was a lot to do with when the services became fare-free. Some riders, they were hesitant to try the service. They didn't want to put a credit card down. When the service was free, they started to move trips over. When we moved the call center for access in-house, it was really easy. The same CSRs were answering the phone, could put the trip on MOD or on access, and was able to give the customers, a lot of information about MOD. So, and that's also when fares returned, the MOD price, we brought it back at $350 compared to the access price of $450. So I think that was another incentive to get riders to try the MOD service. So most of those occurred in July of 2021.
Mr. Miller?
Yeah, another, I think, win-win benefit of the Mobility on Demand program that relates to the will call situation is often, as Commissioner Cox was mentioning, people make reservations for rides to their doctor and home, or any kind of appointment, at the beginning and the end, and then sometimes they're late. What lots and lots of customers are now doing, if they can, is making their reservation to get to the appointment, and then taking Mobility on Demand, not whenever their appointment gets done, say it gets done earlier, at 10:30, then they just call PSDA and they get an Uber ride home right then. And so they're taking advantage of using that Mobility on Demand program. That will also free up more availability for others to get that number that we'll call higher.
How does that hurt us on, I like that, I like that concept right there. But how does that hurt us on cost? Because on the access paratransit, there's a fixed fee for the trip, and it's $30, whatever it is, $30, I'm not real sure. And then on the TD, what do we pay actually for a TD trip?
Do you want to explain that?
Yeah, so do you mean for the MOD?
Yeah.
Yeah, MOD, what do we pay for an MOD?
Yeah, so we pay the meter fare for either Uber, Lyft, the taxi. On average, that fare is around $14. It's pretty cheap.
Okay, and what about the wheelchair ride? How much is a wheelchair ride?
Wheelchair is a little bit more expensive, close to $40
Yeah.
a trip. We do have some riders that choose to take Mobility on Demand home. Some riders do pre-schedule their returns.
So for right now, we're still, even though we're using MOD more, we're still within the budget that
Yes.
we were presented. Okay, that's important.
Oh, yeah.
Because if we start getting unbalanced there, then we're gonna have a problem. And $40 a trip is pretty expensive too.
Yeah.
What's the exact that we pay for an access paratransit trip? What do we pay? We don't pay by the trip though, we pay by the hour, am I correct?
Yeah, it's the platform hour. So the structure with First Transit is we pay a fixed cost every month, pretty hefty cost, and then the variable cost is by the platform hour.
Okay.
So that's running, like you said, about $30 per platform
Okay,
hour.
yeah. Okay, thank you. That's all I have on that.
All right. Commissioner Flowers?
Please forgive me if this is, not a good question, but for persons who are disabled and they have Medicare, does Medicare still provide or help pay for, they don't? Okay.
We're done with Medicaid?
Medicaid, I'm sorry, Medicaid.
No,
yes, please.
Medicaid is paid for.
Medicaid, okay.
But you have to use a Medicaid provider.
Like Yellow Cab.
Yep.
Or wheelchair transport, or the other company. There's a bunch of companies that do that.
Okay.
But there's just some major companies, and one is Bay Area Metro, and one is Wheelchair Transport, I know that for sure.
This is one of our legislative
Yeah.
priorities. Is what happens is that, yes, as Commissioner Cox is pointing out, the Medicaid system, which qualifies folks that are that are eligible for Medicaid for free transportation to any medical appointment,
Right.
which we have a lot of. PSDA, the way the state has created a brokerage system for Medicaid transportation, though, it's very complicated to the rider, and PSDA cannot get reimbursed for access rides that we're spending $40 a ride on through the Medicaid program. So this is on our agenda to work on. I mean, it's a statewide issue, and hopefully we can somehow, lots of folks in Tallahassee keep telling me that they want to work on it because it's not a very good system across the state. We kind of hit a roadblock during the pandemic, though they were distracted. And so, hopefully we can get their attention on this again.
Well, that's why I asked, because I know when I worked at the John and Ruth Clark Health Center, now Community Health Centers, and they have a new name now too, but many of our patients, were able to arrive, and sometimes they got there a little bit early, but that was okay. And then the pickup could be a little confusing, because it would be a little later. But they also had to make reservations so far in advance. I'm sure the system, that part of the system, is better now. I would hope that it's better now, but that was my reasoning for asking to help try to alleviate some of the $40 costs. I know that, we can't do anything here about the expansion of the Medicaid services, and fine tuning how the services are delivered and reimbursed, but, we can certainly continue to make that a priority. I think we will, in Tallahassee, and, but thank you. That was my rationale for asking.
All right. Any additional questions or comments? Nope. All right. Bonnie, thank you so much.
Thank you, Bonnie.
We look forward to seeing this
Thank you
one
for the
pager
update.
regularly.
Bringing these numbers down. Thank
Yeah,
you.
thank you so much.
Our next informational item will be moving on to the fiscal year '23 budget assumptions. We have Debbie Leas and Nick Sagan and Al Burns.
I know.
A triple team.
Yep.
Show me the money.
So welcome to the transition back to
Things being
the
run
new normal. This is the first month that we are, the presenters are controlling their own PowerPoints. Instead of saying next slide to the Zoom. So our Zoom residents.
And we
people
can see
it.
everybody.
Yeah.
That's pros and
Next
cons.
month, we will have this meeting, it'll be upstairs, back where they used to be, in the auditorium. That they've now equipped that area for Zoom,
Oh, good.
and,
Yeah, good.
so our committee meetings will be in the auditorium, and the board meeting will be here next month.
Oh.
You did not mention that at the finance committee. You might want to point that out to
I sh-
finance committee members.
We'll be sitting down here.
They'll sit down here in the dark, and then they'll think, I wonder if it's somewhere else.
Especially Commissioner Gao. He gets lost frequently.
I'm taking up for you, Commissioner. I'm taking up.
I'm just glad it took Vu coming up here, because I was starting to feel really bad. But good morning, everyone. Debbie Leas, Chief Financial Officer here at PSTA. And this morning on this information item, we are going to talk about our key assumptions for the budget. And as I mentioned at the Finance Committee, my colleague Michael Hansen has joined the great wave of resignations, and he is best known for his work on the budget. So I've always been involved in the budget. Nick Sagan, who is best known as our wizard up in the budget area, is also joining us. But I have a new member of the team. Our highly motivated procurement director is now known as the highly motivated director. And I'm including Al into this as a permanent part of his position to work on the budget. It has a lot of synergies with what he does as far as procurement goes and understanding what's coming down the road, both from a capital standpoint and also from the operating standpoint. We've also introduced, as I'll call it, an adjunct professor, Julie Lupus, our Director of Accounting, who is sitting in all of the meetings, and she has been wonderful researching things, because we do a lot of questioning of our directors and chiefs as to why they're doing what they're doing. So I'm really excited about moving forward with this new and dynamic team. Okay, now we can. One of the things we do is over the coming months, we are going to be talking about a lot of the key areas of the budget. And we'll be starting next month talking about our what's known in FTA land as our program of projects. We'll be looking at all of our capital projects. And all of this, each month we'll be bringing something else that's large in the budget to you to have an in-depth discussion. It ends in September with a culmination of 2 public hearings held in the evening, so more people can join us. And at the end of September, we will have a final vote on the budget. One of the things we want to always do is ensure that our budget is reflective of the board's strategic plan. And our strategic plan surrounds sustainability. So there's 3 key elements to that. One of which is our healthy community and workforce, and I think what you all just recommended as far as looking to increase the percent for the poverty level really talks to the healthy community. And we also look at environmental sustainability, and then the other piece is economic vitality. I translate that into Debbie speak as fiscal stability. So those are very key and important items that we'll be looking at and talking about as we go forward. Right now, we're in the process of talking to all the chiefs and directors and going through the detail of their operating and capital budgets. The next step will be meeting with Brad on that, and then in June, we'll bring forth a draft budget to the board in June. That pretty much
don't know what I
describes
touched.
our excitement of the budget process, so.
He's just saying what I was thinking.
There you go. One of the other things that we do is we provide a multi-year budget projection. And this is very important because the decisions we make today have a profound impact on the future, good, bad, or indifferent. So we will be bringing that forth as well. It gives us an opportunity when we look down the road to start addressing any issues that may come up from a very strategic approach so that we don't run into issues as other agencies sometimes do. So with that, I'm going to turn it over to the wizard, better known as Nick Sagan.
Thanks, Debbie. So good morning, Planning Committee members. Nick Sagan, one of the budget analysts here at PSDA. In a normal year, when we put together the key assumptions, what we do is we go out to the county's website and take a look at what their budget office has put together in their forecast. We went out to their website, and it doesn't look like they're going to be presenting that until after their first draft of their budget's put together. We considered doing the same thing, but decided instead we're going to stay the course and give it our best bet. So having said all that, I'm going to be presenting the highlights of our revenue assumptions here. Ad valorem taxes, passenger fare revenue, and operating assistance. So ad valorem taxes. Our current millage rate is at the max amount of 0.7500 mils. We reached out to the property appraiser. They gave us the state estimates for what they think tax estimates are going to increase by. You'll see in future years they continue to increase. As you go out into later years, they continue to increase, but they increase a little bit less. And that's consistent with what we've seen using that information from the county's budget forecast. Passenger fare revenue. So PSDA's passenger fares, our base fare is at $2.25. Or that does include discounts, including flamingo fares. We're assuming 0% there year to year, similar to what we did last year, to give us some leeway to continue to do more discounted promotions in an effort to increase our ridership with the disadvantaged members of the community. We're also assuming a 0% increase on the chance that we end up finding a recurring revenue source of $10 million a year that could potentially replace our fare system. Operating assistance. Operating assistance, we include here the federal operating assistance and the state operating assistance. On the federal front, we have, I think we're assuming an approximately 30% increase in 5307 funds. And on the state side, you'll see that chart below details, our ups and downs for our forecast there. Included in this is the state operating assistance for TD, and as Nicole was mentioning earlier, changing that criteria from 150% to 200% of the poverty line really helps us to utilize all of the budget amounts in TD assistance. So in that graph there, you'll see those ups and downs, and those reflect basically our strategic decisions in how we're going to be using COVID assistance funds and the state operating assistance funds, because there's a little bit of overlap in how we use both of those. hand it over back to Debbie.
Thank you, Nick. On the expenditure side, we're going to be talking about salaries and the fringe benefits. This particular side is talking about the salaries. And we've included in here some estimates and are going to be putting into the budget, at least initially to take a look at it. We just addressed all the SEIU employees. We are going to be addressing as well the administrative employees. As you know, we provided some increases already towards the marketplace for administrative employees. We have approximately 16 employees that are not yet at marketplace. The cost of that is very nominal. What we'd like to see if we can do is bring now the administrative employees up to 100% of the marketplace. Now, that'll cost approximately $300,000. And Brad asked me the question the other day, what happens if we don't give any raises to administrative employees? But that would save us about $288,000. So you can see there's not a huge difference between the two, and that's something we'd really like to continue to address and look forward so we can stay competitive in the marketplace. And with that, I'm going to turn it over to Al to talk about the fringe benefits and other expenditures.
Thank you, Debbie. Mr. Chair, Al Burns, you're a highly motivated, not only procurement director, but director. I just want to take a moment to thank Brad and Debbie for allowing me the opportunity to learn more and to help grow my career. Debbie hit the nail on the head with having me at the table, particularly on these next coming slides. My office buys everything. So this puts me in a better position for strategically, as I know what the market, as I'm watching what the various markets are doing. Also, I keep my eye on the ball and make sure that we stay within the budget, and I know what those actual budget numbers are, and I'm very privileged to have a seat at the table. Employee benefits. This assumption here mainly has to do with employee benefits. As you can see, we're being very, very optimistic in employee benefits by leaving it flat over the course of the next 5 years. One of the things that I would like to bring to your attention, Mr. Chair and committee members, is last Friday, we released the RFP for our healthcare benefits. So we'll be bringing that back to you as an action item, probably around the month of October or something, in the next couple months, I think June or July. We will evaluate those rates, and rest assured, if we see spikes that are well above, that exceed the budget, we do have the flexibility to be able to go back out to market the very next year. So we're not locked in. We're not doing a contract where we're locked in for 5 years or anything like that. Annually, we will review that, and we will, with Debbie's help and Liz O'Hara, the Deputy Director of HR, will evaluate that. One of the things that's unique with this healthcare package that we're going out to market for is we're going to be evaluating not only the current way we do business, but also from a self-assured perspective. So we'll be getting numbers back from both of those, and the Wizard here and Debbie, they'll help staff evaluate whether or not that's more advantageous for us. Lastly, as it pertains to this assumption, in the RFP that's going out, the wellness program is heavily emphasized in that RFP as well. Fuel. Big unknown. We're hopeful. Last week, if I were up here, I would tell you fuel costs are going down. This week is hit or miss, and I don't think we're watching that. Debbie, make sure that we're monitoring that on a daily basis. I am pleased to say, I don't know if I'm pleased to say, but I will inform you that we did lock in gallons for April and May. It was the best that the market we had seen in the market in the last few months, and we wanted to take advantage of that. Additionally, HART is the lead agency. I was part of that contract that HART's been doing for over the last 10 years. And this year, they're going back out to market. This year, they're exercising the last option on that contract. So around the month of June or July, We anticipate being able to lock in those rates after July 6th. The contract should be re-signed, and it will put us in a position where we'll be able to lock in rates for next fiscal year, provided that the trends are favorable for us. Supplies. Basically, what this means is bus parts. If you ask my team, what's the most important thing to Al? And they'll tell you keeping the fleet moving. But as Debbie Leas is my boss, and she makes sure that we're good fiscal stewards for that. Last year, we saw a record high on the index. Contractors were coming to us left and right, asking for relief. We don't just give them relief when they come to us. They have to show the proper documents from their suppliers, and I review that documentation to make sure. And yes, Commissioner Schulman, we do not go over the excess, we do not exceed the budgeted amount, and we don't exceed the contract value. If we do, we have to bring it back to the Finance Committee for approval. There is good news. Over the last couple of months, over the last 2 months, I haven't received any requests for relief or price escalation. So I'm pretty confident that the market is somewhat becoming stable. But, that's like trying to read the tea leaves. Once again, Commissioner Schulman and committee members, I'm very humbled to be able to be part of the budget team and working with Nick and Debbie. Debbie?
Thank you, Al. And as we go forward, some of the things that I think make me smile throughout this whole budget process is we're going to be getting additional funds from FTA that we can put hopefully just towards capital, because that's a great way to invest it. The good news on the table right now is that the full apportionment is out for this coming year, and it looks like we'll be getting a little over $4 million more, so that's excellent news. Being strategic in how we're doing things to use the grant funding that we currently have. However, things that keep me awake at night are things like fuel costs, and I'm so grateful that we're moving forward in a very sustainable way with procuring buses. And we've also received a grant, I think Brad maybe brought that up last month, of the bus and bus facility grant that'll go towards electric buses. We've put in for VW settlement money, and I'm very hopeful with that. And if I get all of that, those paying for 60 buses will be no issue whatsoever. So I'm very excited about that. If we don't get that, I'm taking a look at ways to make sure we can use our formula grants from FTA and continue to go out for discretionary grant funds. So we're taking a look at a lot of exciting things as we go forward. As I mentioned, next month, the next step will be bringing to you our program of projects on the capital side for you to review so that we can get our next round of federal funding. With that, I'll take any questions. We won't ask Al anything, he's too new. But both Nick and I can answer any questions.
All right. Commissioner Flowers?
I just have a question regarding the proposed raises. I don't have a problem with giving employees raises or bringing things up to the market rate, because that is how we retain employees, and we know the cost of living has consistently increased. But for what you're looking at, is that also including the raises that they just recently received? That was supposed to include also bringing them up to some level of market rate based on the study that you all.
Right, there's the two pieces to it is our SEIU, which the board just approved for the rest of the, remainder of the contract over the next couple years. So our budget includes that. And then our budget also includes what was just given to the administrative employees this year. Plus, as I mentioned, we still don't have everybody close to market rate yet.
Okay. And so about how many people are we not at market rate, or what would those positions be? Are they mid-management, a variety, front line?
Certainly. Right now, we have 16 employees that are not at the 95% of midpoint. Our goal is 100%.
Okay.
And so there's only 16, and those are basically at the higher, mid to higher level management levels. What we did during the process, we took a look at our grade levels below 10. And those are our lower paid employees, so we made sure we brought them up to 100% of market rate.
That was gonna be my next
That's
question.
the,
so, yeah.
that was very, very important to us.
That was gonna be my next question, because, I have no problem again with paying people what they're worth, but wanna make sure that our frontline employees administratively, you know, that they're also where they should be.
Absolutely, and that's one of the reasons why we limited what we gave higher level management, so
And
that we
next
could address
week,
it.
I have something that we're going to do differently this go-around, is I'm going to be meeting with the union next week to be fully transparent about this whole process and get their input on anything. I mean, the action that the board took last month, pretty much the vast majority of frontline workers are now paid at a market rate. There's a few exceptions to that we're going to take a look at too.
Okay,
Yeah.
thank you, thank you.
Any other questions?
I have one.
Commissioner Fix Sanders,
Thank
go
you.
ahead.
Sorry I had to step out. I have a question regarding the healthcare benefits. How often, first of all, do they go out for RFP?
We go out for RFP approximately every 5 years. However, it's for 1-year renewal, so I come back to the board every year. The reason we do that, as Al Burns had mentioned, is it keeps them on their toes. It takes a lot of work to put the proposals together, so we like to be able to say, we will do this for 5 years, but you have to stay competitive to earn us, you know, to keep earning us as one of your clients. So that's why we go out, come back to you every year with a review of what we've done, but yet give them the comfort level if they're doing what they're supposed to, they could be with us for 5 years.
Okay, thank you so much for that response. And the reason why I'm asking, and many of us who are also very concerned with the rates of deductibles and things when it comes to healthcare, when we have a provider that we've established a relationship with and we're comfortable, that 5-year time period is sufficient. But then when the year renewal, if you switch benefits and now the benefits that we're currently anticipating for only that year is not one where your provider, your favorite physician is a part of, that can be a dramatic change, especially for those with serious health issues that they've gotten comfortable with. So my question and/or concern is when we're looking into, and especially if it's a drastic change, we're actually looking at changing companies, providers, that we kind of make sure we mirror the benefits where it doesn't far too astray from what our employees, what the family still currently has, as far as health benefits are concerned.
That is an excellent point that you're making, Commissioner. When we were putting together the RFP, part of the evaluation criterion is that network. And I don't want to quote you the percentage that is weighted, but that is one of the more heavily weighted areas in the evaluation criteria. And this time, last 5 years ago, I wasn't at the agency, so we're looking at it a little differently from a competition, a competitive market perspective. But you brought up a very good point, that the network is extremely important. And with the help of Gearing, our benefits broker, we made sure that we put a strong emphasis on that specific piece of evaluation criteria.
Network and also deductibles, because you have some where you might not pay for medication, but you have to meet a $3,000, annual deductible, and I don't know which one is worse, because you have to now meet the deductible before you can get any services. So, yeah, those 2 points I think are drastic, especially when, households with limited resources.
Yes, ma'am. And when I get back to my office, I'll make sure that the networking deductible, I just don't want to say anything that I'm not confident in.
I appreciate that. Thank you so much. Thank you, Chair.
All right, I actually had a couple of questions. All of these numbers are based off of the fiscal year 22 experience or 21 actuals?
This is based off the budget, correct, for 22 compared to 23, is that correct?
Yeah, so it would be, that first year you see the 23%, that's for budget year 2022, the budget to 2023 budget.
Okay.
Projected budget.
So My concern's around the passenger fares, right? So we're showing a 0% increase, which is what we've done in the budget for a while now. But then I look at our statistics, and we're 15% lower in passenger rides. So wouldn't that mean we're estimating, fuzzy math, a 15% higher revenue from going forward?
How we put the budget together, once the budget is passed, we're constantly, as you know, measuring it every single month against budget to actual. When we develop the budget for the next year, we base it off of our forecasts as it relates to it. As you know, this year, we had anticipated in the budget numbers for this year in passenger fares that we would start charging fares October 1st. And we didn't start charging them until July. So we're well below budget, but we will be basing it off of that. So when we look forward and we're saying we're not going to see an increase in passenger fares, it'll be based off of, and it's, I think, a little conservative, but based off what our forecast is. But you're right, I mean, we're doing a budget to budget because we don't have all the forecasts baked in yet.
But our forecasted number's already gonna be
They'll be below.
a good bit higher than the actual, right? So we're starting off, it just, in my mind, you know, and
This is the start. We, like as Evie just said, we haven't actually done the forecast of ridership for next year based on this year's actual activities. What Nick presenting is just sort of what we've been doing, which is the 0%. It probably, based on the fact that I'm looking at the finance thing, $457,000 negative. We're down 13% compared to a 0% budget that we had in passenger fares, which ties to the ridership.
right, so
We'll have to look at that again.
Yeah, so I just want to make sure that our planning assumptions for the passenger fares is starting from a correct point, because we've been at 0 for a while, but we've actually been at negative, and then there was the pandemic, and we didn't have revenues. I get all the things that happened in the recent years, but it would seem to me that we would be starting, we would lower our assumptions on the revenue, right? So if we are being more conservative as an organization, and we already know that we're 15% behind on actual trips, that we would lower our expectations for revenue, and maybe then ramp it up in future years as we work on programs to grow ridership.
From a budget-to-budget perspective, you're absolutely correct. And we will be basing it off of those forecasts. I was kind of tickled by what Nick had brought up from the county standpoint. They're going to, from what we understand, talking with them, they're going to give their budget assumptions after they get the first draft in, because it is such a unusual year with inflation, et cetera. We just wanted to start somewhere and give ourselves a basis, and we drill down deep when we meet with everyone. So you'll have a pretty good idea in June where we stand.
Okay.
And maybe we can update this as well at that time.
I appreciate that. And one of the other items, you know, around the diesel fuel costs, we have the assumptions for costs. And I realize this is a planning starting point, but given the fact that we're also transitioning to electric buses, it would be nice to see our diesel fuel usage assumptions
Yes.
going forward. Like, so we're expecting a reduction in usage or gallons or whatnot over
I
time, so
have
we can
that.
really start to see the impact of the electric buses coming into the budget. So it's not as scary as the,
Right.
as the headline number looks, you know.
It's true. When we receive our first round of buses at the end of 2023, and it won't have a huge impact on '23, but on an annual basis, it'll save us about $500,000 in diesel costs just with those 12 buses. Wow. So, and then the next year, we get another 12 or 13 buses. Now you're talking $1 million worth of savings just in diesel fuel. We also have some estimates on what the increase will be in the electric costs, because we'll be recharging the buses, but it is significant, the amount of savings that we're going to be seeing.
And I realize that that will be in the budget, because
It's-
it'll come out in the actual numbers, but it'd be nice to start to see some of these,
We can
some of our
show those.
strategic objectives in the planning assumptions, so that they're rising to the top, and we can see the good work that we're doing.
We can do that when we bring the fuel. Henry worked with me on a very lovely, what he calls Debbie's crystal ball spreadsheet, that we can plug in what the current fuel numbers are and what we expect the escalations to be. so that you can see the savings by having the electric buses.
And my last question, potentially, is around the fringe benefits. We have 7.5% annual increases on those. What was our 2022 increase?
We had, actually, as it worked out on, we had it about the same. Our healthcare costs went up about 4%, so that was really, really good. I'm not going to get that same warm fuzzy this year because the whole industry is increasing in cost because not PSDA employees, I did a deep dive on this, but a lot of people put things off that they shouldn't have in the industry. So the whole industry is seeing increased costs where someone who should have, I'll use on a female thing, should have gone for their mammogram, but they didn't. Now what is, could have been a stage 1 cancer is stage 3. What we're seeing is I took a look at the usage, had our broker take a look at the usage of what our employees are going for. So we've been very, very good at having the recurring things going on. However, to your point, Commissioner Sanders, we have a significant number of employees with very significant disease or issues going on that are causing, some bump ups. We try to exclude a lot of those, and I keep a limit. I pay for a piece of my policy so that the insurance carrier is picking up excess costs and not PSTA. But of course, they look at that in the renewal process. So that's looking good. Pension actually came in for last year lower than we expected with the marketplace, so that was very good.
Okay.
7.5 may not be enough, though.
On the healthcare side,
Yeah.
it probably won't be. And that's why we're taking a look at what will it be to be self-insured. There's no particularly good time to go self-insured, but I want to see what it is. Because if we're coming in when our numbers look bad, it's only got one way to go, and it's down, and I find it very cyclical.
Is there any way to, with other transit organizations to, consolidate our healthcare and purchase larger, be a larger group than what we already are?
We actually tried that in the last solicitation, and we went in with Hart on the solicitation, and they decided to go their own route. The other thing is, if you've got one group that's healthier than the other, the healthier group complains that they're paying for the unhealthy group.
Yeah.
But I've done that in my past where I've taken an entire county of governments and put them together in one big pot.
Yep. And unfortunately, people don't realize that sometimes they're going to be in the healthy group and sometimes they're going to be in the
That's
unhealthy
right.
group.
It's
And
cyclical.
sharing that reduces the cost over time for everyone. But that's a greater economics lesson. Any other questions, comments, concerns? No? Thank you,
Thank you, team.
Trinity of budget gurus. We appreciate it. Is there any other business for this committee? Actually, I'm going to ask Brad, do we, I know you and I talked about this in our one-on-one, can you give a sense as what we're going to be looking at for reviewing our routes and how we're going to integrate with the Sunrunner?
Oh, yes, and that's right. And the planning committee will see some of this work, and I see Cassandra's over there, maybe she can fact check what I'm gonna say here. So, I think the plan right now is to advance our every 5-year transit development plan work with a RFP going out starting this summer for route planning. And a lot of that work, I think the design of the routes that intersect with Sunrunner, with the Sunrunner fixed guideway will be a big part of that over the next, year? Do you have any feedback on that?
The short answer is yes.
I always like the short answer, but, no, so my hope and my goal from a planning committee standpoint, as I mentioned at the last meeting, was just to make sure that we are actively integrating and looking at combining our arterial routes with our new Sunrunner main line so that we can make sure we have, the best ridership of that system as quickly as possible from it coming online.
Sure, so in the short term, we'll take a look at that through our scheduling department and have our planners look at some of the route development, the route ridership, where stops make sense to consolidate. And that'll be with the opening of the Sunrunner. Then the bigger plan that Brad mentioned and our transit development plan, we'll take a look at our entire system and how we will expand the system or make changes to other routes, not just the Sunrunner, but in other corridors as well. So with that project, we do an origin destination survey. And so that's what he was talking about every year that we do a transit development plan or major update, which is every 5 years. We go ahead and we do a very robust origin destination survey of our riders about how they're using the system, how they're transferring. And now some of that information we may be able to check with Flamingo. And so we're hoping to use that as part of that origin destination survey data that goes into the greater plan. But that is generally the origin destination survey can be quite expensive, but it is a very important data point for us to put together the transit development plan.
I appreciate the longer answer as much as I appreciate the shorter answer. I just want to make sure that we are feeding the Sunrunner line with our arterial routes as best we can to move people about our community.
Right, so the origin destination survey will help us understand where what the transfers are into and out of the Sunrunner line.
Excellent. Any other business? All right, seeing none, this meeting's adjourned. I will mention we are going to be Thursday, the 19th. It's a different day for our next meeting, so make sure your calendars are updated.
How about finance?
Because we're in DC.
Who knows? That's up
Finance
to-
is also the same day,
I know.
May 19th. Okay.
Thank you.
Thank you for keeping me from getting angry.
Oh, yes, I didn't want you to get angry, honey.
Oh, hey, I might not ask you any questions.
I didn't want you to get angry.
Brad, I look forward.
I won't be here. Next week is our
Board meeting?